So understand the anatomy of the chest. So this brown colored cloth piece, let's imagine that this is skin. Under the skin there is breast tissue with gland which gets connected to the nipple here and comes out, and under that there is a layer called fascia which is attached adherent to underlying muscle called pectoralis major muscle. Under this muscle there are other small muscles called pectoralis minor, serratus anterior and rectus abdominis here, and there is rib cage. This is how a normal anatomy looks like. So when we want to enhance the breast, what are the options? We can do fat grafting, filling in the breast gland here and wherever it is necessary. By doing so, we can increase the cup size by 1 or maximum 2 cup sizes. This can be repeated to enhance the augmentation effect. So the next option is to place a silicone cohesive gel implant. We normally don't use saline filled implants, and most often we use silicone cohesive gel implants which are very advanced. Even if we cut, they don't leak silicone oil. Such is the quality we get, and their surface is smooth or nano textured, so capsule formation is very minimal and it doesn't have other side effects like large cell lymphoma, squamous cell carcinoma. They are very minimal. So now let me explain how it is done. Say there is one method called subglandular method, that is lift the gland of the breast and then place the implant on the fascia. Lift the skin and the breast tissue up and place the implant and close. This is pretty simple, and it is used in places where the definition of inner and upper implant is very much necessary. But I don't follow this often. I follow subfacial breast implant. That is, along with the breast, I dissect off this layer which is attached to the underlying muscle called pectoral fascia and place the implant. So this is subfacial implant. Advantage over easier subglandular method is that capsule formation is less and we can easily preserve the nerve which supplies sensation to the nipple areola, and it is more aesthetic. Next option is to do a under the muscle or submuscular option. This is pectoralis major muscle. It is lifted and we place the implant under on the pectoralis minor and the rib cage. But most often what we do is either subfacial, that is on the muscle, below the fascia, below the gland. This is one common. And the other thing what we do is biplanar breast enhancement, where the muscle is released and made to go up. It will not be folded, but it will retract up like this, so that upper part of the implant is covered by the muscle and lower part of the muscle is covered by the breast gland and the fascia. Advantage, it gives a better projection and it corrects minimal ptosis, and along with this we also perform a triangular area here to give smooth appearance fat grafting, and another small crescentic fat grafting I also do always. So which place of which plane of breast implant suits you, whether it's under the gland, under the fascia, under the muscle or biplanar, is best decided in clinical examination and discussion with you.